The Faculty of Medicine at Memorial University is dedicated to building a healthy future for the people of Newfoundland and Labrador. Taking into account local populations and geographic location, Memorial excels at educating physicians in rural practice and supporting health scientists in groundbreaking multi-professional collaborative research.
Well, here in Newfoundland and Labrador, we try to do research that makes a difference, and we try to look at what are the real needs and opportunities within the province that can actually have benefit not only locally, but provincially, nationally, and internationally. In today's world, so much research is fragmented. Nobody puts it together. Our Memorial model for 21st century research is horizontal and vertical integration of research. Starts with a patient or community problem and looks at all the aspects of that, dives right down to find the root cause of it, and then brings it back up through the ethics and legal and healthcare administration, healthcare provision to actually get this into the healthcare system so it's looked after right from start to finish and makes a difference to people's lives right away.
ARVC, which is arrhythmogenic right ventricular cardiomyopathy, is a cause of sudden cardiac death in young people. We know that we have a high prevalence of ARVC in Newfoundland and Labrador, so it would be one of the first we would think about when faced with a family history of that nature. But a lot of what genetic counsellors do is work with large extended families to initially try to work out what the diagnosis actually is. The discovery of the gene TMEM43, which causes ARVC, a particular genetic subtype here in Newfoundland. My work was defining all the families that had this or potentially had this, pulling all the information together from multiple generations, autopsy reports, medical reports. So it's the pulling together of all the multiple pieces of information and ultimately, of course, creating a clinic for these families.
I think we're really at the beginning of understanding how diseases are inherited. The Newfoundland Labrador founded population provides an opportunity to look in and figure out what the genes are and then what people can expect and perhaps how we can treat some of these diseases.
The Northern Family Medicine Education Programme, known as NORFAM, was set up almost 20 years ago by Dr. Michael Jaw and his team. This enabled family medicine residents to spend a significant part of their training for rural and remote practice on location in Goose Bay, Labrador.
Here we train physicians to work in northern and rural areas in Canada, and particularly for our province. Our physicians that we have here are better trained to work northern and rural location and better able to look after our patients well. For all that combined, we can lead to much better services. We can help to improve the health of our population here.
The evidence is pretty solid that if you train someone in a rural area, they're much more likely to go back and work in that type of a place. The training we offered is very broad-based. It's true general practice. Unlike many places, the residents care for a patient that they treat in the emergency room and admit to hospital. The resident is able to follow that person as an outpatient, as an inpatient, and then back in their home community. So there's a fairly seamless model of medical care in which we can provide a whole spectrum of things.
Working in a rural location really focuses you to adapt your clinical decision making using the available resources, using all of your clinical cues. So you're really strongly developing that ability to multitask and focus on many different aspects of a patient's care.
I think one of the main things that I've learned about working up here is to treat patients with different resources in mind. There's been a lot of hands-on and independent learning. At the same time, there's a lot of support that you never feel alone, but you're able to make decisions independently and learn from them, knowing that you have backup if you need it.
It's a really exciting time for the Memorial University Faculty of Medicine. We see ourselves as building healthy tomorrow and doing research that makes a difference, not only the population here, but stuff that has worldwide implications. They see it in their work, they see it in the benefits coming out of the work, and I think that's part of being a small medical school in a small populated province, but a large area, is trying to put all that pieces together in a cohesive way of partnering with others to actually make a difference.